Every year here at Signal River Health System, our team performs more than 10,000 surgeries between the 3 locations. Today, we're here in Ocean Springs to find out more about some of the procedures and the technology, and also the people who make it happen. We're here with Dr. Petrie. He is a general surgeon here at Ocean Springs Hospital. Tell us, Dr. Petrie, what does it mean to be a general surgeon? When you hear that, what does that mean?
To me, it just means responsibility, that you have been entrusted to take care of people, either in acute situations or an elective surgery like we're doing today. That people have been good enough to ask me to take care of them and take care of some of their medical problems. And it's a huge act of faith that they encounter the surgeons and ask them to basically operate on
it. They put their trust in your hands,
their lives
literally.
in our hands sometimes, yeah.
So what sort of procedures do you perform most commonly?
Probably the most common operations we do are hernias and gallbladder surgery, intra-abdominal surgery, and of course traumas and things like that when we're on call. So.
Right. Because anybody who comes to our emergency room who needs surgery, you guys take care of them.
Oftentimes, yes.
Yeah. So what is it like working with the team here? What do you like about working here?
The cohesiveness, a lot of quality. The nursing staff at this hospital is outstanding. And also the collaboration with other physicians. There's a very good medical staff, both in the operating room and outside the operating room. So we're very lucky here. Very fortunate.
Lots of resources. If one person, needs, a second opinion about something, everyone's willing to work together because teamwork always wins.
Yeah, and there's, I'm fond of saying I can't do anything without an operating crew.
That's right.
I'm worthless unless I have the team to help me.
Right.
So.
The scrub techs, you have the assists, you have the nurses, you have the CRNAs,
it's everybody.
The physiologists,
it takes
the
a team.
EDS team. So yes, we do what it takes to make sure that we perform the most high-quality procedures here with the help of Dr. Petrie, so thank you. Signal River Health System has won many awards. Recently, we were deemed a Center of Excellence in Robotic Surgery. We've also have been recognized for our safety in our bariatric surgery, which is what Dr. Payne here, who's with us now, specializes in.
Yep, and we've got a lot of great surgeons. We've got great assets, great rooms like this, one of our newest state-of-the-art surgical suites. And where he has been doing procedures like this for over 10 years. Why don't you tell us a little bit about the different types of things you do? I've got some pain here or here. Tell us some of the kind of things that you can fix on somebody.
So general surgery, very broad, all-encompassing topic. Most folks, when they think of general surgery, have to do with the guts. And so having pain here could be your appendix. You may need an appendectomy. Having pain a little bit higher up over here could be your gallbladder. You may need a cholecystectomy. Having pain over here could be your colon. You may need a colectomy. There's a lot of ectomies involved in surgery. As Sarah had mentioned, we are a Center of Excellence for Robotics as well as bariatric surgery. And
you do bariatric surgery also?
Correct. Do a lot of bariatric surgery, and so folks that are suffering from obesity may need a partial gastrectomy or what we call a sleeve gastrectomy in order to help control their weight.
That's come a long way over the years. I know that we've talked before, and the way that you would do, a gastric bypass or the sleeve, they've come a long way. Like, what are you using now to help people?
Yeah, so years ago, all these surgeries were done open, very brutal surgeries, high complication rate. Over the past 20 years, we've progressed to where all these are done either laparoscopically or robotically, and so it's cut down on the complication rate to the point that it's generally considered one of the safest surgeries in the country compared to knee replacements and cholecystectomy, having your gallbladder out.
And robotics doesn't mean that a robot does the surgery. He still does the surgery with robotic instruments, and it's basically minimally invasive is what the robotic technology allows you to have a much less invasive surgery. Your recovery time's a lot quicker, right?
Correct. The robot is just a tool. It's more of a system that we're able to control to help use for better optics, better visualization, better access to certain parts of the body that we wouldn't otherwise be able to do traditionally. So, the robot is not in control at any point. We are always in control.
You don't go drink a cup of coffee and let the robot do the surgery. It still requires you, right?
Unfortunately, yes, we're not quite to that point.
So what about also another big thing is traumas. So you guys are on call. We have somebody comes in, has a car wreck or some situation that's emergent. Tell us a little about trauma.
We do deal with acute trauma patients as well, car wrecks, unfortunate gunshot wounds, knife wounds, just accidents that happen out fishing. You get hooks in your hand, things happen. We can't always plan for these things, and that's when you need a trauma surgeon around, and traditionally that is also a general surgeon. So again, very broad, encompassing, wear a lot of hats, depends on what day it is.
So if you get hurt or have some pain, come see him. He can fix just about anything, any issue you need, just about.
So back surgery has been around for quite some time. How has the robotic-assisted platforms assisted you and also the patients, with their pain and going forward with living their lives?
Right now, I think robotic surgery for spine is kind of in its infancy.
Mm-hmm.
When you think about robotic surgery across the platform, when you're dealing with general surgery, where you can inflate the abdomen with air, it creates a whole new arena for operations. But in the back, you can't inflate air and create a space to operate in. So the robot is really used as a guidance tool to make the placement of screws more accurate. The surgeon is still doing the majority of the surgery. And at this time, the robot's actually occupying a very minimal part of a spine surgeon's practice. But as time goes on, I think the indications for it will expand.
Right, because the model we have is the Excelsius GPS, which, like you said, is navigation. So it kind of helps you make sure that you're putting the screws in the right place for your vertebrae.
Correct. And I think its strength at this time is people who are in need of revision surgery.
Mm-hmm.
When the normal anatomic landmarks are marred from previous surgery or from deformity, the robot makes it much more facile in placement of screws.
So everyone has back pain. I know I do, even at a younger age. When would you say is it time to seek out a specialist to kind of get it checked out to see, what your options are as far as, making sure your quality of life maybe improves?
Usually the starting point is you see your primary care doctor and let them look you over. If it's a simple problem with just arthritic back pain, typically some medicines or therapy will work. If they deem it's more significant, the doctor can order an MRI or films, or they can also just send to us if they have any questions. We'll happily see people either right off the street or through a consultation.
With everything going on with the pandemic and people, not getting out to their appointments, what would you say to people who, maybe have been holding off to get their issue checked out?
It's been a bit of a problem with COVID because people are staying at home and not seeking medical care for fear of getting out and catching COVID.
Right.
All the while their medical condition is progressively worsening. So I think with the number of people vaccinated today and the incidence of the virus decreasing, I think people should focus on taking care of themselves and get in to see a physician if they need to.
We just got Dr. Noblin, an orthopedic specialist coming out of surgery. Tell us, Dr. Noblin, what do you have on your plate this week as far as procedures?
Just finished up with a shoulder fracture. We have a couple of robotic knees coming up in just a few minutes, and then we'll finish up with a couple of ligament reconstructions on the knee. Finish today.
So we just got an award for our Center of Excellence in Robotics. You work with the Mako, right?
We did a Mako, and then the Zimmer system is called a ROSA, which is the one we're using today, but we use a little bit of both of them, and they're extremely helpful. I think it's really going to make a big difference in the coming years in terms of outcomes.
Makes it
for
minimally
everybody.
invasive. People can get back to life quicker with the robotic-assisted technology.
It's not as minimally invasive as much as it is just it leads to perfection. It leads to a reproducible result, and I think patients are going to do much better. So I think they will be able to get back and stay alive a lot quicker.
Precision, perfection. That's what
right.
it's about.
That's
I
right.
love it. Tell us a little bit about, well, first of all, how long have you been operating here in the Cedarburg Health System?
23 years.
23 years,
Right.
all with Bienville? 23 years?
That's correct.
Wow. So we're very fortunate to have specialists like you on our team, and not just for the elective things, but also for trauma. If somebody gets in a car wreck or other issues, tell us a little bit about some of the types of things you deal with in the trauma world.
I think the whole group covers the hospital, obviously, in terms of any kind of trauma, but we take care of any of obviously the automobile accidents that come through, or any kind of slips and falls and breaks, and so that comes from hip fractures all the way down to motorcycle wrecks with significant open injuries. So the whole gamut of things we kind of take care of when we're here.
Fix just about anything.
That's right.
Our orthopedic surgeons are here to put you back together and also help you alleviate pain. When is it time for somebody who may have some joint pain or back pain to come reach out to you and the team?
I think whenever it starts really affecting your daily life, the things that you do, we got a lot of things that can put people back and band-aid people that aren't surgical that we can see, and then obviously if they fail the conservative ways, then obviously the surgery may be the right answer. Anything that really impacts their day-to-day life, I think it's time, and we can help.